everyone, it's Miss Sullivan. I was going to go ahead and make a video and try to walk you through how to give a bath so that you would have access to this at home and when you're practicing. So the first thing you need to do to get ready to give a bath is to check your physician's orders. Make sure there's no activity limitations that keeps you from being able to move your patient or anything like that, so make sure you check your physician's order first. Then we have to gather our supplies that we need to give the bath. So we're going to need our bath basins, one for washing and one for rinsing. We're going to need our soap, whatever your facility has, or if your patient has a preference, you would want to try to get the soap that they like. If they want deodorant or lotion, you need to bring all these supplies in with you so that you're not having to go in and out of the room while you're doing the bath. We also need washcloths, towels, we need our pillowcase, our pad, we need a fitted sheet, a flat sheet, and a gown. Okay? You will also need gloves for this procedure, so make sure that your room has some gloves. So those are all the supplies that we actually need for the bath. So now we're getting ready to enter the client's room. Okay? So we'll knock on the door, and they will allow us to enter. Good morning. My name is Tara, and I'm going to be your nurse today. Can you tell me your name? Tell me their name. I also check their armband to verify their patient identification. You always check your patient identifiers when you go in a room, no matter what you're doing to this patient. Ms. Smith, I'm going to go ahead and give you your bath. Is this a good time for your bath? You want to make sure it's a good time for them. They may be visiting with people. You just want to kind of have them involved in making that decision. So she tells us it's a good time. Go ahead and adjust your thermostat in your room so that it can be warming up while you're getting your supplies ready, because this bath can make them very cold. So make sure you do that. I'm going to go ahead now and walk over and wash my hands. Okay, so now I've washed my hands. I also brought a linen cart in the room with me. So I do have a linen cart to put my dirty linen. Okay. So at this point, I'm going to go ahead and put my gloves on. And you just wear clean gloves for a bath. You don't have to have any kind of sterile gloves or anything like that. This is not a sterile procedure. Okay. All right, Ms. Smith, I'm going to go ahead and take your blanket off, okay? Most of the time, unless their blankets are soiled or wet, we reuse their blanket. So what we'll do is just kind of fold it up. And I'm just going to set it to the side. Make sure that you provide privacy for your patient and pull the curtain too so that nobody walks in on your patient. I'm going to go ahead now and get my water ready. You want to make sure that it's warm. You don't want it too hot or too cold. Throughout the bath, you want to make sure that you're checking your water temperature so that it doesn't get cold. And what I like to do is put my soap. If I have any kind of lotion, I will sit it down in my water. so that it won't be cold. It'll actually be warm. Many patients thank you for that because the soap is not cold. Okay. I'm going to sit my linens on my other table over here so that they are out of the way. All right, Ms. Smith, are you ready to get started? She tells me she's ready to get started. You want to make sure that you communicate with your client the whole time, letting them know what you're doing. Get my linen keeper over here. I'm going to raise my bed to a comfortable working height so that I'm not hurting my back. At this time, I'm going to let the side rail down. You want to make sure you leave your side rails up unless you're directly in contact with your client because you don't want them to fall. So when we go to if we have to go to the other side of the bed, you'd want to make sure that you always raise your side rails. Okay? All right, at this time, I'm just going to kind of pull her top sheet around, kind of like a little diamond shape, and make her bath blanket just to cover her up and keep her covered at all times. Because you don't want to expose your client. You never know who might walk in the room, so make sure that you're keeping them covered at all times. And I'm going to go ahead and take her gown off. If she has an IV and your gown does not have snaps on it, like most hospital gowns do, then you take it off of the opposite arm without the IV first, and then you would take your bag of fluids and your tubing and go up through your gown and take it off. Okay? All right, Miss Smith. Hers is tied, so I'm going to untie it. You doing okay, Miss Smith? Just make sure you always support their joints. Make sure she's covered. Take the dirty gown and put it in my linen hamper. And you can see how I have her covered to where she's not exposed. I'm going to go ahead now and take a washcloth and wash her face. We do that without soap or anything like that because it can irritate the eyes, and I'm going to make me a little bath mitt. Now, it's very important how you clean their eyes. You always clean from the inner canthus out. So we're going to start here and go from the inner out. Take the other side of our washcloth from the inner out. And then we'll just clean the rest of her face. Most people don't want their face dried, but if she wanted her face dried, you could go ahead and take your towel and dry her face. Okay? At this time, I'm going to take a towel and I'm going to pull this down so that I can just pull the towel back when I get ready to clean her chest area, okay? Now I'm going to go ahead and put a towel up under her arm. Raise her arm. Okay. I've got a washcloth in my wash pan, and I'm putting one in my rinse, okay? And I'm going to get my soap and put it on my Right. And now I'm going to wash her hands and her arms. Start with her hands, and I'm going to get in between her fingers really well and use long strokes up her arm. And then I'm going to ask her to raise her arm and clean her axilla. Okay. And then I'm going to rinse. And I'm going to dry. Make sure you dry in between the fingers really well because they will hold moisture. And make sure you get up under her axilla. And you could go ahead if she wanted deodorant and go ahead and put her deodorant on while you're doing all this. Okay. For time's sake, I'm going to just tell you that you would repeat the same steps just like this on the other arm. Just the exact same fashion, okay? And now I'm getting ready to do her chest. So I'm going to go ahead and get my rag. Get that out. Get my soap. I'm just going to expose only what I need to clean. And I'm going to clean her chest. If she has, if it's a female and they have breasts, you want to make sure you lift up with the breast, with the back of your hand, and go up under the breast really well. Okay, back up. Now I'm going to rinse. I'm going to rinse under the breast. And then I'm going to dry. Make sure you dry under the breast really well because they will hold moisture. Okay. Now I'm going to move down to the lower abdomen. And I'm only going to expose the areas I need to clean. So, yeah. You okay, Miss Smith? Like I said, just keep an eye on your water temperature. Make sure it's not getting too cold. And now I'll dry. And now I'm going to cover her back up with my bath blanket. Okay? To keep her covered. At this point, I'm going to put a towel up under her legs. Okay. So, all right. Then I will do those long strokes up towards her heart like I did on her arms. Now one thing you do have to be careful with clients, if you're bathing them and you notice they have a reddened area that's swollen in their leg, you want to make sure you avoid that. It could be a DVT, and we don't want to rub that or massage it and make it move. So make sure you don't mess with an area if it looks like that, okay? Alright, so I've washed her leg. Go ahead and wash her feet. Make sure you get in between the toes really well. And now I'm going to rinse. And you would repeat the same with the other leg, okay? If someone's feet were pretty dirty, you may want to change your water because it may be dirty. So just be cognizant of that, okay? So I'm going to cover her back up. At this point, I'm going to talk about the perineal care. With a female, you would put them in a dorsal recumbent position with their knees up, and with a male, they can be supine. Okay. I'm just going to show you on her. All right, Miss Smith, we're going to be touching you down here, okay? I'm going to try to do this quickly. Now, there are times when you may encounter a bowel movement or something else in the bed. The best way to handle that is just to contain it as best as you can. You may have to use extra towels, different ways to contain it, get the patient cleaned up, and then you'll change the linen. Okay? All right, Miss Smith, I'm going to be touching you, okay? We're going to clean the outer labia first. Then you will retract the labia and clean always front to back. You're going to clean and straight down the middle. But you always clean front to back on a female because we don't want to introduce bacteria from the rectum into the urinary meatus and then get a urinary tract infection. Okay? So at this point, I'm going to change my washcloth. And I'm going to rinse. I'm going to spread the labia, and I'm going to go front to back and front to back, okay? And I'm going to toss that one too. Paper towel. And I'm going to dry. Front to back always, okay? And then I'm going to cover her back up. Oops. And put her legs back down. With a male, you're going to actually have to grasp the shaft of the penis. If they are uncircumcised, then you've got to make sure you pull that foreskin back, clean around the meatus downward, and then clean around the scrotal area. Okay? Rinse, then dry. If they're uncircumcised, once you're finished, you want to make sure that you put that foreskin back into place. You don't want to leave it retracted. If they are circumcised, then you would just grasp the shaft of the penis, clean around the meatus, down the shaft, around the scrotal area. Okay, so it's just a little bit of difference. Okay, so now we're done with the front of the client. I have changed my washcloths after I clean the perineal area because I don't want to clean the back with the same washcloths. Okay. If for some reason your gloves got dirty, like you cleaned feces or whatever, I would change my gloves. Okay? Alright. Alright, Miss Smith, we're fixing to turn over, okay? Can you tolerate your head being let down? And she says she can, because many times that's going to make it easier for you to make the bed. Now, if you have a client that you can't move by yourself, then you're going to have to arrange for help to come and help you turn the client. So just be aware of that. You may have to call on the call bell, ask for help. If it's a cooperative patient that can turn for you, it makes it a little bit easier. Okay. So we've got our bath supplies, and now we have our linens, because we're going to change our linens as we have our patient turn on their side. Okay? All right, Miss Smith. Take these towels out. All right. I'm going to slide you toward me just a little bit, Miss Smith, okay? I'm going to ask her to bend her knee for me. I'm going to get you to hold on to that rail as we turn over, okay, Miss Smith? All right, on count of 3. 1, 2, 3. We're going to turn over, Miss Smith. Okay? And I'm going to take that bath blanket and cover her up. All right. You going to be okay to hold that rail? She says she's okay. All right? I'm going to take my towel and lay it right here on the bed. don't sweep it toward the vagina or the meatus because you're going to introduce bacteria. Okay? You may have to take the back of your hand and lift up the buttocks. Alright? Like I said, if there is stool, you will have to contain that first and then clean up. I'm going to throw that in there. I've got my rinse washcloth. I'm going to rinse the back, and I'm going to rinse the buttocks, and now I'm going to dry. You could go ahead if she wanted lotion on her back. You give her a little back rub and circular motions. Many patients, that helps relax them. Okay. Ms. Smith, you okay? Okay. All right. Now we're going to change our sheets. What we're going to do is just fold them up as close to the patient as we can get them. Okay? You want to get all that you can done without having to roll the patient 1,000 times, because many of them cannot tolerate that. Ms. Smith, you okay? She tells me she's okay. You want to make sure you're talking to your client, keeping an eye on your client. You're going to tuck your new sheets under your old ones. Now, I'm telling you this because I've seen it. If there's stool, you may have to take towels or an extra pad and put it under this dirty to where it doesn't get on your clean stuff. Okay? Then we're going to take our little pad. Now, you don't want it way up here, because when you go to pull the client up, it's going to be up at their head. So you want to make sure it's far enough down under their buttocks to where you can pull them up in the bed, or if they have a bowel movement, it will catch it. Okay? All right, Miss Smith, we're going to roll over, okay? You're going to roll over a big hump. Side roll up. Okay. All right, Miss Smith, I'm going to let you roll the other way, okay? Just like we did before. Let me put my side roll down. All right. And let you roll. All right, Miss Smith, you can roll back on your back. We have you fresh sheets. Okay. You doing okay? I'm going to go get your gown. We'll put her down over her, and then I'm going to take this other dirty sheet off. Okay. Alright, now if you had an IV and it did not have snaps, just like this gown, when you go to put the gown back on, it's right the opposite. You would want to put the arm with the IV in first. So we would take our IV fluids and our tubing and put it through our sleeve. And now I'm going to change her pillowcase. In the hospital, we don't change pillowcases like we do at home. You want to make sure you don't put pillows under your chin or anything like that because they have germs. Alright, Miss Smith, I'm going to change your pillowcase. So the best way to do it, to not have to do that, is to make it kind of like you're doing pantyhose and just roll the pillowcase down. We're going to put the pillow inside and then just kind of roll it over it. Okay. Alright, Miss Smith. Now I'm going to put her fresh sheet on. You want the seams to be away from her skin. You see the seams? You want them away from her skin. And every facility will have it folded just a little bit different. You don't want to fan the covers like you do at home because there are germs on the blanket, so you want to try to be as careful as possible about that. Okay, at this point I'm going to make a mitered corner. Show you how to do that. To make the bed look a little nicer, you come down, and pull up like this right here. It's much better with a smaller blanket, but this is all we have. And just tuck it under. And when you let it down, it's got a mitered corner on it. You have a mitered corner. You can pull up just right here just to give them a little bit of slack on their feet so that it's not pulling on their toes. Make them look really neat. How do you feel, Miss Smith? She says she feels much better after the bath. I'm going to give you your call light. Here's your call light. It's right here. Call me if you need me, okay? Do you need anything before I go? You always want to make sure they don't need anything. I'm going to let her bed down to the lowest position for safety. Make sure both side rails are up before you leave her. Okay. All right. Then I would clean up my supplies. You'll take the dirty linen to the appropriate place at your facility. I will take my gloves off. will wash my hands. And that completes the bath. If you have any questions, please feel free to email me.